All right. Hi there. So, welcome to this session on track and trace. This is presented to you by Sue Denning and MB Bola Lucas, who are both public health program manager. They're working in Tower Hamlets, and they'll be talking to you about some advice for families in terms of the keep the track and trace. I can't say it. So I hand over to them both now to kind of present to you a little bit of a little bit of an introduction, and then they'll be answering questions that different families have been asking. Obviously, everyone is very welcome to question in the chat box at any time during this session, and they'll be answered as soon as possible.
Great. Okay, morning everybody. Hi Abimbola, how are you?
I'm well, thank you, Sue. I am well.
Good.
I guess I'll start by introducing myself, even though Bernice is done. So I'm Public Health Program Manager, and I work in the Children and Families team within Public Health of the local authority.
Great, and a privilege to be working with you. So I'm Sue Denning. I work in the Healthy Communities team for Public Health in Tower Hamlets, and yeah, delighted to work closely with Abimbola and the Children and Families team, who are really the leads on this area of work. Okay, so we just wanted to run through to try and help do a little bit of clarification, because we know that there's very complex rules around COVID-19, and sometimes there are different sources of information saying different things, and it can be a little confusing. So we're wanting to try to help to provide some clear information. I think we'd really welcome questions, Abimbola, wouldn't we?
We would, most certainly. So if you do have any questions as we go along, please feel free to type them into the chat function of within Zoom, and we'll be happy to answer them as we go along. And if there are any questions that for whatever reason we're unable to answer at the moment, definitely once the video is posted, we'll be sure to make sure that we address those questions.
Great, thanks. And just to say, I don't think I can see the chat questions while I'm presenting, so please don't think I'm ignoring you. Abimbola and I are going to work on this together, so we'll be doing a double hander. Okay, so I'll just give a little bit of an overview about some of the key points, but feel free to ask your own questions as we go along. Okay, so we wanted to cover a little bit around looking after yourself and your family, to outline about the transmission of the virus and what we can all do to help keep ourselves and our families safe. And then just clarify issues around self-isolation. So who needs to self-isolate, when and for how long? A little bit on where you can get testing, and just to acknowledge there have been a few problems about testing in the borough previously, Abimbola, weren't there?
There were. So there were issues around, and this was a London-wide issue. So it wasn't just Tower Hamlets, and that's really, really important to note. But it was a London-wide issue around not being able to essentially test as many people as needed testing, essentially. But a lot of those issues we've worked really, really hard locally to resolve. And we now feel that it's a lot easier to get a test should you require one. Definitely within the slide deck, as Sue's mentioned, we will be going through where you can get tested and how you can get tested if you're still somewhat unsure.
Yeah, great. So yeah, we've got 3 centres up and running, and a 4th one coming on board very soon. So yeah, it's a good improvement, isn't it? Great. And then we've got a little example of a case study just to run through about how a family would cope with if one person started to get the symptoms, and what the rest of the family should do. So we'll just walk through that. And then there's a few resources and support structures and information about where you can get further details. And yes, some points, some questions that came up when Katie Cole, who's our public health lead, our consultant for children and families, on the parent discussion that she had last week. So we've got a few questions and answers from that, which might be helpful to clarify any key points. Okay, so just to reinforce, Abimbola, I know the discussions we've been having with our colleagues in education and across health visiting and school nursing is that being in school is 100% definitely the best environment for children to be in. And that's the safest environment for learning, and it gives them both immediate and long-term benefits. So we know that young people have been settling in really well, learning and thriving, that they've been really enjoying being back in school and feeling happy about, you know, the opportunity to get out there and play and see their teachers and study together, and that they're actually feeling happier and healthier, as well as the fact that we know that school is a safe and caring environment for everybody, and there are lots of positive outcomes, so both in terms of children's learning but also their opportunities to you know, keep their friendships going, to have that social contact and have, you know, emotional and physical support as well. So just to reinforce that we think school's the best place. Anything you wanted to add on that, Abimbola? I know that's 100% what everybody's feeling about schools.
Yes, most certainly. I guess it's just to really reiterate what you said, and just to say that, you know, schools have put a lot in place to really support children and young people coming back to school, to make the school environment the safest place for children to be, to both learn, to develop, to kind of just add to their skill sets, because we do have to remember children being at home long term does start to have implications not just on their education but just their ability to socialize, their mental well-being. So there are many benefits to children being back at school. So we really want to encourage parents to, you know, feel confident that the school is the safest place for children to be.
Absolutely, and that goes for colleges and universities as well. Yeah, as far as possible. It's really important that people keep up their plans and their work towards their goals in education. Right. Thanks. Okay, so just to touch briefly, so looking after ourselves as parents is also really important, and we know this is a demanding time for everybody, especially people who are you know, juggling more constraints and demands on them with family and caring responsibilities. So looking after yourself is still really important, and schools will be working with the Educational Psychology Service, and often they're using something called the SWAN framework. We'll just touch on very quickly. It's just the concept of, if you're looking after other people, you actually have to look after yourselves too. It's quite a hard message, that, for parents sometimes, Abimbola, isn't it?
It is, it really is, because parents often focus on looking after their family as a whole, and they often forget themselves. But again, that's one of the really good things with this SWAN framework, and it's really just a way of making sure that you focus on yourself, and understanding that in focusing on yourself, when you're sort of well and happy, you're able to support other people.
Absolutely. So getting a bit of relaxation, a bit of fresh air and exercise, and just doing something fun and relaxing for yourself is really important to then have the energy and emotional reserves to be able to support children and older people.
Yeah.
So yes, schools are making themselves safe, welcoming, helping everyone in the community to feel that they're all supporting one another together and in the situation together, and that they're very nurturing places. And just to recognise that children and adults are probably both feeling a little bit more, you know, concerned. People can be more on edge and find it a bit harder to focus on things. People can be more there could be more family issues or school issues. So just helping to have a little bit of focus on helping to look after our emotional needs as well. There's something called the zones of regulation, which is basically just like a traffic lights lollipop, but it helps you have something you could put on your fridge to say, look, I'm feeling in the red zone today, or I'm feeling amber, I'm feeling okay, or actually I'm feeling green, life is good. And it's a way of helping people to express and talk to their emotions. So literally just a lollipop stick or a little picture with red, amber and green on it that you can use to help discuss emotions with children and young people can be very helpful for us all to have that awareness. And helping to be nurturing, so helping to think about amplifying our strengths, celebrating the good things that are going on, connecting to something else going on in life. So it could be gardening, it could be art, it could be music, whatever helps you feel positive, telling good things about one another and helping to set goals. But just moving on to thinking about COVID-19. So we know that coronavirus is just part of the continuum. So there's the common cold, there's bronchitis, and then COVID-19 is one of the SARS groups of virus. So it is part of a continuum. And we do know that the majority of people who've had the virus, 80% of people have only had mild symptoms and have managed that themselves at home. Only 15% have had to go to hospital, and of those, only 5% of people have had severe issues. So,
Sorry to interrupt you. We do have a couple of questions on the chat that I thought that we might quickly just take a quick break just to answer. There's one specifically. I have lost the chat function. Okay, so I'm just going to read out the question. So it says, great tips around emotional well-being. I know children have been very disappointed when they're sent home from school. This is around bubbles, for example. So when a child is part of a bubble and then they are sent home from school, they've been obviously quite disappointed. So the question was really around whether or not, apologies, I've lost the chat function again. Where are we? Is there anything that we could suggest for processing the whole being at home? And I'll just kind of start by answering the question that I've just asked or read out at the very least, to say that there are a lot of things at the moment. The council are definitely looking at how we can better support children and young people who are being sent home from school. Obviously, schools are putting in place things to ensure that children and young people are not missing out educationally in terms of their education and learning. So there should be learning packs being put together by schools if they're not already available, to ensure that whilst they are at school, whilst they are at home, I should say, self-isolating, that they are able to continue with their education. In addition to that, there are a number of services that are supporting, I can certainly say from the viewpoint of young people, to support young people whilst at home. So an example of this is KOOTH, which is spelled KOOTH, and that's basically online provision for well-being generally for young people. So if, for example, you're a young person, you're just at home, you're starting to feel very disconnected from everybody just because, you know, you spent a number of months being at home and now you're back at school, but now having to self-isolate again because your bubble is off. This is a really good online service. It's totally anonymous. It's totally free. So you're able to kind of log on and just speak to someone about the issues that you might be experiencing and facing. We also have the VIEW service, which is the Tower Hamlets Emotional and Wellbeing Service. And again, I will ensure that we put all of these in a link below the bottom of the video so people can kind of click onto this. But again, they support children and young people at school, in school. So as long as your child is of school age, then you can receive support around sort of low to moderate mental health issues. And it doesn't have to be sort of, really, really deep mental health issues. But if you are just experiencing some levels of anxiety because you're just worried about being at home, then again, that's a fantastic service that you can tap into. And Sue, I'm leaning on you now because I know there are a number of other sort of community-based offers as well that young people can tap into.
Absolutely, yeah. So just the Healthy Communities team is working with communities driving change, and that's on 12 estates around the borough. There are voluntary sector staff working directly with parents and with young adults. So in Bromley by Bow, we've got quite a lot of activities that are linked up. So there's a children's reading group, there's arts and crafts activities going on, there's quite a lot of filmmaking, which they've just been making films with older young people, sort of from 16 to 25 on the particularly linking with the Burdett Football Club. So there's quite a few activities like that. And I know in other parts of the borough, there's a mentoring scheme that the Young Foundation team have been working on. There's a range of different sort of physical activity and chat functions, there's photography projects, all sorts going on. And obviously there's the youth service as well. So a lot of activities through our borough youth service and through Spotlight are still going on. Some of them are online now, but it's still an opportunity for people to link up and discuss and play games and interact around things that they're interested in.
Yes,
so
just to add to that, there is a really, really great online provision called the Padlet, which was developed by the youth service. And that's essentially a platform where you can find out about a range of different things available to you as a young person, many of which you can still do whilst you're self-isolating. So again, it's just an opportunity to kind of reach out to other young people who might also be self-isolating and just try something new in your time.
Exactly, and also the voluntary sector have got lots of projects that are still running as well. So Half Moon are doing like drama type workshops. There is a lot going on. So I think if we can perhaps we'll add some of the links in, and then people can find communities driving change pages and the Padlet. And just to flag, there's also the Healthy Schools information that goes out to schools every week, and that helps to give an update. And I think that's accessible online. And then the Family Information Service and their e-newsletter and their regular newsletter, and links through the parental engagement team, which each school is in touch with. Plus all sorts of specialist individual agencies, so support for young adults with special needs and young children and young people, Apasanth, and yeah, a lot of parenting support organisations as well. So yeah, we'll do a little list that could be added on with additional links.
Again, thank you, Sue. There is another question in the chat function, and again, it's around if I meet someone who develops symptoms 2 days later, do I have to self-isolate? And we did have a really useful slide around self-isolation, which we will just jump across to, just because we know that there are still loads of questions, and it's an area where people are still quite unsure what to do and when to do it, if that makes sense. So once that slide comes up, we can talk through that.
Great. So just to flag, these are the key symptoms that we need to be looking out for. So a longer term, a more severe cough, high temperature or fever, and smell loss. So losing your sense of taste and smell. And then there are other symptoms you can see around fatigue, and particularly shortness of breath. So if you have got any of those symptoms, it's very important that you don't send your child to school, that you stay at home and you book a test, and you inform the school immediately that you or somebody in your household has started to experience COVID-19 symptoms. And then that's when the whole household needs to isolate. And You can access a test by calling NHS 119. That's the key number to phone. Although it's slightly different if you have a child under 5, Abimbola, isn't it?
Yes, it is slightly different. But again, I guess it's almost like if you have a child under the age of 5, the best thing to do would be contact a GP for assessment, which would be on 111. And then you'd be able to take advice from them, essentially, whether or not you needed to order a test and the next steps to take. But if in doubt, just call 111 and you will be able to get sort of very clear directions about what you need to be doing next and what steps you need to be taken, especially if your child is under the age of 5.
Right. So just to clarify, there's 3 centres at the moment where you can get tests. So there's Billingsgate Fish Market, the Idea store in Watney Market, which is relatively new in the last 3 weeks, and then Marland Pavilion, which opened last week. So all of those are up and running now. And then there is a 4th site that will be developed on the Isle of Dogs that's just in the process of setting up. So that should be available from next week. But all of those need to be booked through dialing 119. And obviously you can also ask for a home test kit to be sent directly to you at home. So just to come back to the question, so if anybody has symptoms, the person with symptoms must isolate for 10 days, but anyone in the household or in immediate contact, so somebody who's been in close contact, talking to somebody without mask for at least 10-15 minutes, been within 2 meters or particularly 1 meter, and or travelled in a car with somebody, so they're more direct contact, then they would need to isolate for 14 days. And we've just been through the information about getting a test. Just to clarify, that was the slide you were thinking of, Abimbola, wasn't it?
So the question was around whether or not if you had been in contact with someone 2 days before and then sort of were in contact with somebody on a Monday and then on Wednesday they developed or they started to show symptoms of COVID-19. So because I guess it's the easiest way to explain it is to say that because you have been a contact, so i.e. you have been in contact with that person within 48 hours, then the answer is yes, you do need to self-isolate. And the reason behind that is because before someone actually starts to show any symptoms, they can still have the virus. And at that point, they are still able to transmit the virus. So if you have been in contact with somebody, up to 48 hours before they have developed symptoms, then yes, you need to self-isolate. And you fit into the top middle box. So i.e. you're not a confirmed case, but you're a contact of a case. In which case, yes, you do need to self-isolate.
Thank you. I think that was very clear. Should we just think about the issue that if you're a contact of a contact, then what do you do?
Yes, and I think this is one that often confuses people. So I guess the best way to kind of talk through some of this sometimes is to give examples. So if your child goes to school and as has been the case across the borough on a number of occasions, you receive a letter from your school to say that your child needs to self-isolate because somebody in their bubble, which is often a year group, has tested positive for COVID-19. In that instance, your child needs to self-isolate because they are a contact, but everybody else in your child's household, so you as the parent and any other siblings and any other family members that are in that household, do not need to self-isolate because technically they're classed as a contact of a contact.
Yeah.
And that's the reason why they don't need to self-isolate. So it's only when the person, the individual, has been in close contact with the person who has tested positive, do you need to self-isolate.
Thank you. I think that helps to clear it up because I know with some parents it can be quite tricky where they've been told one child is a contact, but they may have a second child that they still need to be taking on to school. So it's only the child that was the contact directly that needs to self-isolate. The second child and the parent are fine to carry on going to school.
Exactly. I think one of the other things just to kind of point out is there's always questions around who needs to get tested and who doesn't need to be tested. So I think, again, this is sort of the bottom half of this table here. So the only time you need to get tested is if you are a suspected case because you have some of the signs and symptoms of COVID-19. So i.e. a loss or change in your taste and smell. You've got a new persistent cough, or you have a high temperature. So again, if your child is in a bubble of someone who has either tested positive or has symptoms of COVID-19, your child doesn't need to get tested unless they begin to develop symptoms of COVID-19. So if they stay pretty much well and healthy, then they don't need to get a test at all. They just need to remain at home for the 14 days. Once that period has elapsed, and as long as they are well, they can return to school.
Thank you. That's very helpful just to clarify. Okay, so just to follow up on that, so if your child has had a test and the test is negative and they don't have symptoms, then that should be okay for them to return as well, as long as they're not a close contact of somebody who has just been confirmed as having a positive test. Yeah, and if they haven't been advised to self-isolate by NHS test and trace, and if they're if they have had a cold or a flu, or obviously there's lots of other winter cold symptoms that could be going around, as long as they haven't had a temperature for 48 hours and no diarrhea or vomiting, they're feeling well, then that's fine for them to return back to school.
To go back to a question which was in the chat function, which was, do we expect the rate of school bubbles going into isolation to increase over the winter? And I guess the thought process or the thoughts behind that is because people are thinking, as we move into winter and children begin to develop sort of colds, do we expect the rates of bubbles to go up?
So if you do have a cold or flu, what we'd really recommend that you do, like in any cases of illness, is make sure that you're doing the catch it, bin it, kill it technique. So make sure that you've got a tissue that where you can sneeze into your tissue, or have something to to catch any mucus. Make sure you throw that tissue away immediately, and obviously do really thorough hand washing as soon as possible after somebody's blown the nose. And this is just a good strategy for keeping yourself healthy and reducing all sorts of infections, isn't it?
It is, most certainly. And I guess, yeah, it certainly is.
Yeah, so actually helping to make sure that children have got tissues before they go to school in their pocket could be helpful. And we do recommend that that the spray flu vaccine is taken by as many children as possible, because that just helps to keep down the flu virus that's going around, which can also make people feel unwell and lower their immune system. Yeah. Is there anything you wanted to add on that?
Yes, I guess it's just to really confirm and to add to that by saying that, there are some symptoms that may well cross over in terms of when you have a cold. Sometimes there may be loss or taste in taste of food, for example, in which case, because that then falls into a symptom of COVID-19, then yes, that child needs to self-isolate. But some of the more general things around a cold, so i.e. sneezing, if a child is sneezing, then as a parent, you don't need to to be suggesting that your child needs to self-isolate, because that's not a symptom of COVID-19. And I guess it's just really, really important that we separate the two, if that makes sense. So if your child or young person develops symptoms of COVID-19, then yes, they do need to self-isolate. But if they don't have symptoms of COVID-19, and actually they have symptoms that are more common with a cold, then they shouldn't be self-isolating. So in theory, we shouldn't have an increase in bubbles just because we're going into winter period per se.
Great, thank you very much. And I know the Care Confident resources can be very helpful for parents, can't they?
They are very helpful. Again, we will endeavour to put this as a link at the bottom of the video once it's uploaded, so parents can go back to this and just kind of read through it. It does act as a really good resource, and if you've got any just questions that you want to ask, many of them are actually answered within this guide.
Great. And the sort of examples that from Care Confident are that is this kind of helpful, friendly information which gives you the key points. So we know that if a child has fever, particularly if they're under 5, then it's very important to take, more rapid action. Make sure that you are contacting a GP or 111 at an early point. But I think that the guidance is very, very helpful. And obviously it's important to just go through some of those steps initially. And if you feel that that their fever isn't resolving after a short period, then it's very important to talk to 111 and think about taking further action.
Yes,
yeah. Okay, so just back to testing and tracing. What we want to just stress is if we have more early recognition and detection of COVID-19, then it helps to keep your family and everybody in your local community safer. So in your housing estate, in your block, and in your school. So it is really important to take note of any symptoms that you've got and to take action. So yeah, if we're all helping to let other people know, either that we've got symptoms or we've been in direct contact with someone who's got symptoms, and people get tested, then it helps to protect us all, and that will ultimately help to make Tower Hamlets a safer environment and protect our communities of more vulnerable older adults or people with additional conditions. So the symptoms we've been through, and the ordering system. So just to clarify, isolating initially, getting a test, and then responding to the test and trace. So making sure that we do provide information to the NHS test and trace system about any other people we've been in contact with, and doing that like as soon as possible, particularly within 24 hours ideally, or 48 at the most. And making sure that we just follow simple infection control procedures. So, wearing a mask when you're out and about in the community, and particularly when you're visiting other households, because we know it's household visiting, which obviously in many areas around the country where we've been described as being at high levels of COVID-19 risk currently. So obviously London, we've been asked not to do any household mixing currently. So making sure that household visiting is stopped currently, and also making sure that we keep space, the 2-metre space when we're out and about, and doing very frequent hand washing. Those are the critical issues. And we just wanted to run through a case study just very briefly to reinforce the issues. So if we've got a family where the mum starts to develop a new continuous cough, then it's really important that immediately the mum and the whole household start isolating. So just to clarify, Abimbola, I know you mentioned this before, but can you just re-explain why one person has to stop for 10 days and the family for 14?
Okay, so the kind of rationale behind that is because actually the mum might have is infectious before she develops the symptoms, if that makes sense. So it's almost like she's further along on the journey than the rest of the family members. So that's why in this example, the mum would only need to self-isolate for 10 days, but the rest of the family, albeit that they're well and they don't have any other symptoms and they don't develop any symptoms, they only need to self-isolate for 14 days. But there are more days for the family member because they're family members, because they're slightly, the mum is further on along the line or the chain of COVID-19, and hence why she only needs to self-isolate for 10 days.
Great, thank you. So the mum orders a home kit, and very importantly, she does that within the maximum time of the first 5 days, but ideally really right at the beginning of developing COVID-19 symptoms. And then she's tested positive. She gives a list of contacts, the NHS test and trace, and very importantly, phones the school. So let the school know straight away that she has had symptoms and is concerned, and that she's had a positive test. So really immediately the symptoms are confirmed as being COVID-19, then that information must be sent to the school, and that the school will do deep cleaning and the senior team will meet and look at what actions they need to take. Yeah, anything you wanted to add on that, Abimbola?
Yes, it was just a note that I think we've tweaked this slide ever so slightly. So in this second slide, it's actually referring, because the child, who would obviously be at school age, is actually a contact of the child is a contact, and then any other children within the school environment would be a contact of a contact. Mm-hmm. There are no real actions to be taken for the school and the children of the school, other than the child who is the child that, you know, the child of the mother needs to obviously stay home and continue to self-isolate. But in that example, as we kind of talked through, because the bubble would be a contact of a contact, as long as the child doesn't develop any COVID-19 symptoms, the bubble would continue as normal at school. And I guess the picture only changes, or the circumstances only change, if the child in the house then develops symptoms of COVID-19. In which case, that changes the situation a lot. Changes the situation, and it becomes really, really crucial for the mother to call the school and let the school know that the child has now tested positive for COVID-19. So just kind of going back to the slide before, where the mother kind of calls the school and they arrange potentially a deep clean, and then the senior leadership of the school kind of meeting to discuss next steps. This kind of is looking at a circumstance where the child also develops symptoms and essentially tests positive for COVID-19.
Thank you. I think yeah, absolutely. That's very helpful. Great. So the test and trace people will phone you and ask for any people that you've been in close contact with, so that they can phone and inform them that they could be at risk and make sure that they're aware they need to get testing and also start to self-isolate themselves. So this is just a way of helping to bring down any possible increase in transmission and help to make sure that we're keeping our housing estates, blocks, you know, local communities safe. Okay, so as you said, when the child develops symptoms, or if the child develops symptoms, that's when it's very important for the school to be notified. Okay, so should we just talk a little bit more about hand washing and keeping safe and what you do if you are being asked to self-isolate.
Yes, most certainly. I wondered, I'm just double checking whether or not we had any more questions as I'm running out of time, and I just want to make sure that we've answered any questions. So again, just a call and an ask for anybody who does have any questions. So please feel free to use the chat function to drop any questions, because as we kind of draw the session to a close, but again, if there are questions that people have, once the video is posted, again, please feel free to put your questions in the sort of chat function of where the video is posted. And again, we can pick up on those questions in another session or just answer them directly.
Right. So just to say, there are lots of things that we can do to help protect ourselves and our family. So the key issue is minimize contact with people, particularly anyone who's unwell. Make sure you do frequent hand washing, and also clean all the areas more frequently where several people would have been touching those, door handles, light switches, bathrooms and kitchens, and do the respiratory hygiene. So do the catch it, bin it, kill it if you've got any coughs or sniffles. Just clean rooms regularly, just with your normal household detergents and soaps, and then do have more ventilation. That's come up as being fairly helpful, hasn't it? Yeah. So just keeping windows open more, so let more fresh air in and circulate fresh air. And then just think about the COVID-19 as being a risk continuum. So the more we can isolate household from household where we know that's the maximum amount of transmission, the better, because it's usually adult to adult where the virus passes, isn't it, Abimbola?
Yes, that seems to be the most prominent way in which the virus is transmitted, and it's also occurring within the home, and that's where we've kind of moved within this high level, why we've moved to households no longer mixing at all. It's really just to try and flatten the current curve that we're seeing in COVID-19 cases.
Yeah. So making sure that we're washing hands, we're keeping masks on to minimise the virus being transmitted, and we're keeping the 2 metre space distance. Those are still the key messages. And just to say, when you're hand washing, there's lots of little places that's easy to miss. So particularly the tips of your fingers, your thumbs, and the actual palm. So really doing a thorough scrub, as you can see on this picture, can be very useful. And actually teaching children to really wash hands well is something that's quite important, especially after blowing your nose, or every time, obviously, after using the bathroom. Yeah, the care confident resources are helpful. There is information on the NHS website and on the borough website about keeping safe. There is also information from how to self-isolate. So making sure that you stay at home in one room as much as possible. Really wash your hands with soap and water very frequently. Make sure you cover your mouth and nose with a tissue or with your sleeve if you're going to cough or sneeze. Keep the windows open and make sure you clean regularly. And there's information on the central government website about coronavirus. We've also got NHS volunteers and the borough volunteer support system, and particularly for residents where self-isolating is causing you not to be able to go at work and financial implications, then there is a resident support scheme, which you can find out through the COVID-19 self-isolation support request. So it's definitely helpful to look at that, and that's particularly for any residents on benefits currently. There is also additional support through the borough and voluntary sector for accessing food, and some schools are still helping to provide additional food support. And there is the NHS phone app, which can help to give you more up-to-date information, let you know levels of coronavirus risk in your area, and there's a QR scanner which can be useful just to make sure that you're passing on contact details. Plus there's a way of helping to check if you do have coronavirus symptoms and to order a test and help just make sure you have access to current information. And we've also got the COVID-19 community champions. So that's, again, a way of you being able to get up-to-date information. So please do join COVID-19 community champions yourself. We'd be very keen to have a member of each school community join up. So you just go online to towerhamlets.gov.uk COVID champions, register there, and then every week there's an opportunity for you to have more information. You can see I've just clicked on the link there and it's come up with information about COVID champions. And really just to say thank you very much for listening. Thanks for your questions. And Avambola, we really appreciate your input. And it's great to be doing teamwork and linking up with Family Playroom as well. So thanks for the opportunity. Anything you wanted to just add to wind up? Were there any other questions? Oh, can't hear you at the moment.
Sorry. So just to say that there weren't any other questions. Thank you again, Sue, for the session. I think it was really, really clear. And we hope that it's answered some of the questions that people may have in and around COVID-19. But again, these aren't one-off sessions. So if people do have some really key burning issues that they would like us to tackle or talk about, then please feel free to drop them in the comment section below, and we'll do our best to answer them.
Great. Okay, thank you very much. I think we're out of time.
Thank you very much both for your participation. It's really appreciated, and for your time. And so this will be available on our Facebook page and on our YouTube page as well. So thank you so much for taking the time today.
Great, delighted to be with you. Thanks for the opportunity.
Thank you. Bye.